Hello, nurses. This is Kevin with Nursing KAMP.com, and these are my scribble notes on nursing in the NCLEX. Today's focus on statins. And statins aren't stats, so no stat grapefruit. And medication camp of cardiac camp. You can find me at this study sheet on Instagram, Facebook, Pinterest, also as part of my books on Etsy, or free with my membership at nursingkamp.com. Okay, this is part of my ABCCDs of cardiac meds, and where I cover acute meds, beta blockers, calcium channel blockers, calcium glycosilides, diuretics, electrolytes, and everything else. Everything else, statins are everything else. They are cholesterol lowering medications like simvastatin or pravastatin, and they lower lipids. And in NCLEX, when we're looking at statins, some things that we monitor are, we don't give it with grapefruit. We don't give it with grapefruit juice because it interacts with and causes problems with statins. Also, we monitor for liver disease. Patients with liver disease, especially when they first start on a statin. So on a statin, you have this enzymes right here. Okay, AST and ALT. Right? These are liver enzymes. And this is covered in another lecture, and this is called a liver diagram. But primarily, see this word AST, right? So, statins are statins, and there's your liver enzymes. And that's normally 10 to 40, and this one's 10 to 50. So elevations of liver enzymes are acute with this medication. How do we know it's working? And that's generally how you're tested on this content, is that a patient is started on statin medications. All right, well, it's not the front line. You don't just start people on statin meds. You actually start to do diet controlled first. And then as they start to do diet controlled and they watch the diet, if it doesn't work, and they generally will have a total cholesterol drawn. And that total cholesterol should be less than 200. But the total cholesterol is interesting because the total cholesterol doesn't mean that they have hyperlipidemia. It doesn't mean that. It's just a screener. So 200 means, hey, check a total lipid profile. And what that means is that we need to evaluate this 200. Is it truly high? So we just don't start them on medications from a total cholesterol. So we end up doing a lipid profile, and that's fasting. And when you do a fasting lipid profile, you're trying to look at the other cholesterol medications. So total cholesterol, 200. That's elevated, that's bad or not. Then we go to triglycerides. We want that less than 200. Then LDLs. L is LDLs, lousy. We want those low. And that's about 150. We want it less than 150. And then HDLs is the last one. And we want that greater than 50. And that's different for females and males. Females are 40 and males are 50. Okay. But that's H, happy, good cholesterol, right? So we want that high. Well, if they are on a fasting lipid profile, they are elevated. That means the statins or the diet controls aren't working. So they need to either be put on statins. And then this cholesterol meds will deal with this hyperlipidemia. While they're on it, we want to monitor the liver enzymes so that they don't use this liver toxic. Okay, because cholesterol is made in the liver. All right. All right, let's go back to A whales and let's assess statins. What else? Is it acute or chronic? It's chronic. It's a chronic medication. It's in the lower levels, A, B, C, C, and D, E. It's the E of everything, right? It works in the liver by inhibiting reductase that makes cholesterol. It can cause muscle pain. So muscle pain is a problem. So we hold it when there's cramping, muscle pain. That will stop after they stop the statins. We also hold it if the liver enzymes are elevated. Assessment, assess for pain, cramping, muscle pain. We also assess the liver enzymes. Labs associated, AST, ALT, liver. Eating, no grapefruit, no stat grapefruits. And what stands out? Well, when you think about liver statins, you think about the liver enzymes. There's assessment. There's also cholesterol numbers. You need to know, what's a normal cholesterol and what the screening mechanisms are with it. So statins are given a lot, so we need to know about the comorbidities of that medication in all aspects, especially liver enzymes and cholesterol markers. My name is Camp, and this is Nursing Camp. This is my medication camp on statins, and as statins are not statin, neither is a grapefruit. You can get all my study notes on Instagram, Facebook, Pinterest, and my books are on Etsy, as well as if you join Nursing Camp, you can get books for free. That's it. Now nurse on, and I'll talk to you next time.